Startling evidence shows many women could be a heartbeat away from a heart attack and not even know it. Now, new breakthroughs in care are uncovering the hidden factors of heart disease before it's too late. Dr. Noelle Berry-Merz of the Barbra Streisand Women's Heart Center at Cedars-Sinai Heart Institute says when it comes to heart disease, men and women are not created equal. Her ongoing studies reveal that there is a fundamental difference between the sexes and their warning signs of a heart attack.
We are in our 20th year of studying exclusively women and ischemic heart disease, and we're excited about the new findings about female pattern ischemic heart disease. It's growing. It's probably at least a third of how women present with their heart disease, and it explains perhaps why women are often misdiagnosed or completely missed, meaning not diagnosed, and then they don't get treated and sometimes they die. The reason women are more often missed with their heart attack is their hearts are smaller. And our diagnostic test that we use for a heart attack is the leakage of a blood enzyme from the heart muscle into the bloodstream. We take a blood sample, we run it. We run it against a male standard. And because women's hearts are smaller, so when they have a heart attack, the amount of scar tissue is smaller, they often, 1 out of 5 times, will not register as having a heart attack. And it's just a simple explanation as the heart is smaller, and that we should have male standards and we should have female standards because it's such an obvious difference. This is one of the things that we're advocating for at the federal level. It's very clear that men and women's symptoms of heart attacks and even heart disease can differ. So where 1/3 of women will have that typical Hollywood heart attack, it's chest pressure, it goes away if they rest or they take a specific medication. But most men will have that, so that's called male pattern heart attack. Women, 2/3 of women will have other symptoms, such as some kind of chest discomfort, but it might be attributed to their stomach. It might feel like heartburn or a stomach upset. They might be short of breath. They might be sweaty. They might attribute that to hot flash symptoms. So we have to be open to this idea that anything above the waist in a woman that is unusual for them should be reported to a healthcare provider. I have been known to tell women to tell them that you're having chest pain when you get to the emergency room, even if it feels like stomach upset or shortness of breath, because they will respond to chest pain. That is the male standard that the paramedics, the nurses, and the doctors have all been trained to respond to. We continue to have problems with awareness. Women continue on the street to say that breast cancer is their leading healthcare threat, despite the fact that it is heart disease, and heart disease kills more women than all cancers combined. It also has to do, in our research, with what we call blame the victim. Women don't want to talk about things that they think they're going to be blamed for. So when women don't exercise enough, or when they don't have time and can't eat right, or they're worried about the physician telling them that they're overweight, they don't go in, they don't talk about it, and they push it to the back of their mind. In our Women's Heart Alliance survey, we surveyed cardiologists as well as primary care physicians. Half of the primary care physicians were internal medicine family practice, and then the other half were OBGYN. And the biggest knowledge gaps were in these primary care physicians. They acknowledged, a majority said that they understood that women and men could present differently with their heart disease, and yet they did not acknowledge, they did not believe that women and men's heart disease was actually different. So we continue to have a knowledge gap, and we're working hard on educational efforts to get this message out to the physicians as well as the women in the community.